Hi, I'm going to talk to you now about breastfeeding and the benefits of skin-to-skin contact. Skin-to-skin contact means exactly what it sounds. It means that you place the baby directly against your bare chest, and it's most important right after delivery. The thing about skin-to-skin is that, we want it to be immediate and we want it to be uninterrupted, at least for the first hour or until the first breastfeed. So that doesn't mean like, oh, you're going to have the baby and then the baby's going to go to the warmer and then the baby comes to you. It really means that the baby is going to be like kind of patted dry and immediately placed against you. And if you can talk to your provider about this before you get to the hospital, that's great. But also talk to every nurse that you have and say, I really want to use skin-to-skin contact immediately after delivery. Right after delivery, most hospitals will put erythromycin, which is an antibiotic, inside the baby's eye. And then we also give a vitamin K shot to help with the baby's clotting factors. And all of this can either wait or it can also be done skin to skin, which is my favorite thing to do because, babies respond differently to pain. So, that when we give them that shot in the thigh, they feel more comforted whenever you're holding them skin to skin. Skin to skin contact is so good for your baby. One of the most important things that skin to skin does is it helps to keep your baby warm. It's just like when you're in bed with somebody and you're like, oh my God, get off of me, you're so hot. It's the same thing. The baby's right here, and then your body heat transfers, and your body heat naturally increases just to keep your baby warm. Skin-to-skin contact is also, it also helps to regulate every single vital sign for a baby, from temperature to oxygen saturation to, like I said before, how they respond to pain, absolutely everything. The babies just love skin-to-skin contact. Skin-to-skin contact has also been proven to help moms breastfeed sooner, breastfeed longer. It helps to establish their milk quicker. So there's just so many breastfeeding benefits to skin contact. But even if you decide, you know what, I don't care what anybody says, there's no way, I don't want anybody looking at my boobs, I don't want anybody near my nipples, no, it's just not for me. It's still good to utilize skin contact. So not just for breastfed babies. It's skin-to-skin contact is good for moms because whenever your baby is placed skin to skin, it releases all of these really natural hormones that make you feel really good and relaxed and euphoric, and this is what helps you bond with your baby. This hormone also helps your uterus to contract, which will also minimize your bleeding. So if you take anything away from this, I hope that everybody wants to do skin to skin, is able to do skin to skin. Of course, if you deliver and you're surprised with a NICU baby, your baby has trouble breathing, or there's something wrong with your baby, the nurse is going to have to put the baby in the warmer to properly assess the baby and resuscitate the baby. But if not, then the best thing that you can do for your baby to increase your chances of being successful at breastfeeding is to put your baby skin to skin contact immediately and uninterrupted after delivery. Oh, and one more thing. So, even before you go into labor, talk to your family. Nobody knows more than a labor nurse that everybody loves a baby. So tell them, for at least the first hour or until I breastfeed, I'm going to hold the baby. And, kind of like set that expectation so that nobody just like swoops on in and takes your baby from you.